Hey guys, Dr. Andy here today. Today I want to show you dry needling the elbow for tennis elbow. This is actually, the real term for it is called lateral epicondylitis. It is actually an overuse injury of the tendon of the wrist extensors. So, this is Miss Katie's arm right here. What I'm going to show you is that wrist extension is when we bend our wrist backwards towards our elbow, right, but going backwards as opposed to going forwards. And what this does, and you can actually put your hand on the outside of your elbow, and as you pull back, you can feel tension along the outside or the back of the forearm. Well, this muscle actually ends in a little tiny tendon on the outside of the elbow. If you have golfer's elbow, which is actually a wrist flexion injury, then the pain is along the inside of the elbow. But with our tennis players, with anyone with a repeated wrist extension, right, you're actually going to have a lot more pain along the outside. All right, so this is for our tennis players out there. Okay. An overuse injury is just that. It means that while the human body is supposed to be able to do that motion, basically we're doing it too much and not giving ourselves enough time to recover. And over time, all of that micro trauma just gets worse and worse and worse, and we develop a lot of pain with it. And it's actually coming from a loss of blood flow to that area. And we've just worn that area down and caused lots of wear and tear, okay? So we're going to show you how to dry needle this area, and what it's going to do is a couple things. Number one, it's going to improve our pain almost immediately. Secondly, it is going to increase blood flow to that area, which is actually going to speed up healing, which is exactly what we want for repetitive stress injury, okay? So we are actually going to start on the outside of the elbow. We find the tendon, all right, that attaches to these wrist extensor muscles right along here. And we put two right in the elbow, right into that tendon. Perfect. And the other two small ones we're going to put on the other side. So we're going to put right in between the thumb and the pointer, and one more in between the metacarpals of the hand. And then lastly, we put two needles right into the belly of the wrist extensor muscle. Remember, this is an overuse injury of the wrist extensors. So this muscle right here along the outside or the back of the forearm is what I care the most about. And that is what needs the most TLC. So right into those wrist extensor muscles, and we got one more to go. And as you can see, it's not a lot. It's a pretty quick treatment, pretty harmless, right, Miss Katie? Mm-hmm. All right, perfect. So that's all we do. We let them hang out here for a little while. Remember, again, it's going to help speed up healing. It's going to do that by increasing the blood flow to this area, and it's also going to help with our pain. The entire idea is that I want you out on the tennis courts again tomorrow, okay, and be able to kind of hit and play and have a good time, all right? So if you have any questions, if you're struggling with any elbow pain, it doesn't have to be the outside of the elbow. Obviously, we do work a lot with golfers and golfer's elbow along the inside as well. It's similar, but just flip the arm over and do the other side, okay? So if you have any questions, let me know, and always remember to live with passion, not pain.